How do founder mutations affect colorectal cancer risk in ethnic groups? Imagine your family history as a map that guides your understanding of health risks. Some genetic changes, called founder mutations, are more common in certain populations because they come from a shared ancestor. These mutations can influence how likely someone is to develop colorectal cancer. But how does this work across different ethnic groups? Let's explore. Founder mutations are specific genetic alterations that appear at higher frequencies in certain populations. These mutations often affect genes involved in repairing DNA or controlling cell growth. When these genes don't work properly, it can increase the chance of developing cancers, including colorectal cancer. The impact of these mutations depends on the population and the specific gene involved. In some ethnic groups, like Ashkenazi Jews, certain founder mutations are well known in relation to Lynch syndrome. Lynch syndrome is a hereditary condition caused by mutations in mismatch repair genes, which normally fix errors in DNA. People with Lynch syndrome have a higher risk of developing colorectal cancer. Because of these founder mutations, the incidence of Lynch syndrome and related colorectal cancer is higher in these populations. For example, specific mutations in genes like MLH1 and MSH2 are more common among Ashkenazi Jews, which partly explains their increased risk. In contrast, mutations in BRCA1 and BRCA2 genes are also found as founder mutations in some populations, such as Ashkenazi Jews and French Canadians. These genes are more known for their link to breast and ovarian cancers, but they do not seem to significantly raise the risk of colorectal cancer. So, while these mutations are important for other cancers, they don't majorly influence colorectal cancer risk. Genetic studies also show differences beyond inherited mutations. For example, individuals of African ancestry tend to have higher rates of somatic mutations. These are changes that happen in the tumor cells themselves, in genes like CRAS, APC, and PIK3CA. These acquired mutations can affect how tumors grow and respond to treatment, and they may partly explain disparities in colorectal cancer outcomes among different ethnic groups. But these are not inherited founder mutations. They develop during the course of the disease. Research also indicates that epigenetic changes. These are modifications that affect gene activity without changing the DNA sequence, can differ among ethnic groups. For example, some minority populations tend to have unique epigenetic patterns in genes related to metabolism and cancer risk. These differences can influence the age at which colorectal cancer develops and how aggressive the disease may be. Understanding how founder mutations and other genetic factors influence colorectal cancer risk helps doctors identify who might benefit from earlier screening or genetic counseling. It also highlights the importance of family history in assessing risk. If your family has a history of certain cancers, especially in populations known to carry specific founder mutations, discussing this with a healthcare professional can be very helpful. They can recommend genetic testing or tailored screening plans to catch issues early. In summary, founder mutations can significantly increase colorectal cancer risk in some ethnic groups, especially in hereditary syndromes like Lynch syndrome. The specific mutations and their effects vary across populations, and other genetic and epigenetic factors also play a role. Knowing your family history and understanding these genetic influences can help you and your healthcare team make informed decisions about screening and prevention. Always consult with medical professionals for personalized advice and risk assessment tailored to your background.